Dr. Sangeeta.
Good afternoon, judges. Good afternoon, everyone. My presentation is on correlation of histopathological features and clinical findings in pterygium. As we all know, pterygium is a fibrovascular subepithelial growth of allostatic degenerative bulbar conjunctiva over the limbus onto the cornea. It is a common ocular disorder with a prevalence of 0.3% to 29%. Hot climate and UV radiation are identified to be the most important risk factors. So, and here surgical excision is the most important treatment option, which is preferred for cosmetic reasons as well as astigmatism. And complications of this the common complication is recurrence. So another ocular surface disorder which share a similar risk factor, that is UV light, has a potential to coexist with pterygium is ocular surface squamous neoplasia. The prevalence of OSS in pterygia varies from 5 to 30%, and this depends on the UV exposure and patient's immune status having similar symptoms with serious implications, making the diagnosis more challenging. So the aim of our study was to correlate the clinical findings with the histopathological features of pterygium. So this was a retrospective hospital-based study conducted on 48 patients, and our observations are these, where we observed more of female patients, about 38 out of 48, and bilateral pterygium was noted in 30 patients. Astigmatism of more than 2.5% was noted in 29 patients. And most of these pterygium, they were in grade 1 and grade 2. So coming to the symptoms, most of these patients who reported to us, they were for cosmetic reasons and foreign body sensation. All the pterygium that was excised were subjected to histopathological evaluation, which showed both epithelial as well as stromal changes as shown in this table. And correlation of these histopathological changes with the clinical symptoms, that is the redness, was also statistically significant, which is confirmed by chi-square test. And so the second correlation was these histopathological changes with the grading of pterygium, which also showed statistically significant changes confirmed by the Fisher exact test, where here I would like to stress the dysplasia that was noted in 2 cases. So the association between these 2 diseases, that is pterygium as well as OSSN, is the common factor of sunlight exposure that results in overexpression of P53, whereas the role of human papillomavirus is unclear. Although male preponderance is reported, in our study we saw more of female patients, and acute inflammatory changes were noted in the younger age group, whereas elderly patients, they showed chronic changes. So this is one case which I would like to show here, which was an eye-opener for all of us, and which also changed it changed our clinical practice of pterygium in our institute. So this patient who reported to us like a pterygium initially, the observation was like a pterygium, and on careful observation, here we see an OSSN that is emanating from the head of the pterygium. And subsequently, after subjected to histopathological examination, we found there was a conjunctival squamous intraepithelial neoplasia, and the last picture is the post-operative picture taken at 8 months follow-up. So to conclude, the clinical symptoms and appearance of OSSN and pterygium often have similarities, which makes definitive diagnosis challenging at times to avoid severe end of this disease spectrum, that is sight-threatening as well as life-threatening. So this calls for a pathological audit of all the pterygium specimens so that patients can be warned for the possible recurrence at a later date. Thank you.
Nice presentation.
Thank you, ma'am.
Any questions?